This is The View from Israel. Welcome to the show. I think you'll find this edition very relevant and interesting, and I'll be talking with my special guest about COVID-19 and Israel. We'll be talking in some detail about the developments in Israel to solve the problem of COVID-19 in all its forms. But before I get into that, and before I introduce my guest, I recommend you stick around to the end of the show for a couple of special announcements that I have, which may concern you. One of which might be of special interest to those of you who plan to fly into Israel in the next few months, or those flying out of Israel in the near future. And I have another one which would be useful for you, those of you who are countering the nonsense and lies being spread against Israel. I think you'll be very interested in what I have to say about that later on towards the end of the show. But getting back on today's show, today's show is going to be very informative and useful, and I suggest you get yourself a pen and paper because you might find you want to make notes. So, okay, let's get on with the show. My special guest is Michael Ordman. And Michael has been providing thousands of people globally with the latest developments of what's happening here in Israel that have improved the lives of many of us around the world we live in. Hello, Michael. Welcome to the show.
Hello, Barry. Nice to be here.
Right. I understand you provide regular updates from Israel on items including health, the Israeli medical achievements, Israeli global reach and economics and business, science and technology, culture, entertainment, sport, things like this. So pretty wide ranging. The research must be pretty intense, right? Especially if you've got thousands of people around the world waiting for your regular bulletin. So why don't you tell us, how did you get started basically in good news or very good news for Israel?
Thanks, Barry. Yes, we made Aliyah from London about 13 years ago in 2007. Took early retirement. I was always been a Zionist, and in the UK we defended Israel against media attacks, especially by the BBC. But when we arrived in Israel, the country was just starting to blossom, and I think the mass Aliyah of over 1 million Russians in the 1990s was making a big impact. Many were young, highly intelligent, ambitious, and anti-socialist budding entrepreneurs, and they're just coming into their own with leadership from the army and then university schools. And Israel used those skills to sort of suddenly become the startup nation. It also coincided with building desalination plants, and we discovered natural gas off them in the Mediterranean. But these world-class universities had suddenly produced these fantastic entrepreneurs bringing things, medical, scientific things. So I saw this and I got this excellent book. It was just published at that time called, got around the wrong way. There you go. Startup Nation. Dan Senor and Saul Singer, and I read that and I was blown away, and it just sort of inspired me to sort of say, well, people have got to know about what's going on here. They're only hearing bad news about Israel. Let's give them some good news, positive feedback. Israel is an amazing country, and it sort of inspired me to sort of start this newsletter. So 10 years ago, it started going out to a few family and friends, and then, but over the 10 years, it's, as you say, it's become going out now. I send it out directly to 3,000 people directly by email, post it on my blog site, and it goes seen by the same number, another 3,000 on there. But more, it goes on to syndicates, it's onto other various websites like Janglo for Israel, and also one of the huge organizations called United with Israel. They have 9 million subscribers. So they see it on there as well. So hopefully the message is getting out to all over the world that Israel is an amazing country and it's producing all this stuff that people can't do without. So that's how it started. Every article I've ever produced, and there's 17,000 articles now that I've come out on my newsletter, they're all stored away in a database which is searchable. So if you need to have any information on any particular subject, whether it's a medical one, say multiple sclerosis or cancer, go just put that into my search engine, and it will come out with all the different treatments and innovations that Israel have got on that particular subject. So this is how it started. It's developed. It takes so much of my time. I have no time to go and do anything else really, apart from come onto your program, Barry, and tell people about it. And so that's really where it's come from.
Okay, yes, it's interesting, Michael, that you mentioned Startup Nation, which I agree with you is an excellent book. But I actually, prior to that book, I wrote an article which went viral over the internet. It was an article which says, if you're going to boycott Israel, do it properly. And basically, it listed all the things that were on the market that people can't do without at that time, and tempting what I call the BDS idiots that if they really want to boycott Israel, they should start off by throwing their laptops, their telephones, their computers, and look at their health products and throw them away. But yours is a more positive note. So I understand, apart from your website, that you have a bulletin. How many people are logged on to you? What's your global reach right now?
It's difficult to say because statistics is very difficult to estimate on the internet. But I mean, if United with Israel publish it, I see thousands of people hitting the good news on there every week, and it's quite amazing. You see what people get when they get my email, they forward it on to their friends. So one person will forward on to 100 other people. So if you look at that sort of that hit, then those people are receiving it who I don't even know about. Eventually, some people come and say, "Can I have my own copy of it?" And then I add them to my direct email list. But most people are quite happy to see it from other people, and I'm just happy to see that it's getting printed off in some places, put on synagogue seats when we used to have synagogues open, and people are reading it who don't even not even interested in Israel, and it's changing the minds, I think, of people who are important. We say that 5% of people probably are very actively involved in supporting Israel. 5% are no more than that. 10% of people are actively against Israel, and then there's these sort of 80 to 90% of people who don't care or don't know about Israel. And that's the thing we're trying to get through, because we can change mindset of countries by actually getting this information out. That's the important thing. Yes, there are key influencers who we really need to get to, and they're probably the politicians, and they need to see this. I don't think they're getting to see this enough at the moment, and I'd love to get people who are watching your this video, if they have got contacts in the high up echelons, get them to see this, because the media won't put it out. The mass media, the MSM, will not actually show this information. They're on a different agenda. They want bad news. That bad news bleeds, and it sells papers. So this good news needs to be shown to these top people, but also to the majority of people who don't know about Israel.
I mean, it's very important that the people who go about their everyday business don't know in which ways that Israel is in the background there, helping them to a better life. But let's get on to the specific issue of the Wuhan virus, as I call it, or coronavirus, or COVID-19, however you prefer. Tell us a bit about how Israel is tackling and, in fact, succeeding in trying to find a solution for this awful plague.
I mean, the actual infection rates at the moment is now all over the world is going up, and it's also going up in Israel. And from a personal point of view, it's difficult to tackle this virus. It's a new virus. Not much is known about it, so we're learning as we go along. And in terms of Israel, there's been a lot of people saying that there's bad things about it. But I had an amazing lecture by a professor at Shaarei Tzedek the other day, and he was telling me exactly what is going on in the hospitals, and that's where the action place is. And in fact, in the hospitals, he's saying from when COVID started to hit, it was hitting the sort of the 80 to 95 age group, and that was killing people very, very quickly. Thank God we had a lockdown at that time and we weren't getting too many people infected. But now this new wave of virus is actually changing those demographics completely. The people in the hospital now are the age 50 or so. That's the average age. And they are the ones who are heavy smokers, obese, have got really serious underlying problems, and they weren't taking care of themselves properly when they had the chance to get a bit more freedom. So it's a complete change. And also the hospitals have got different treatments now. They are using when they do check your lungs, they find if you've got something on your lung and you've been diagnosed with COVID already, you've got something on your lung, then what they do is they give you steroid treatment straight away, and that stops 30% more people from going from what they call the moderate stage with something on their lung to the serious stage where they need some oxygen intervention to help them to help them to live, really. So that has been changing a lot. They're also using different treatments that around remdesivir, I think it is pronounced. I'll check that one. These are actually working as well. So there's a lot of good news about that. When it comes to Israel, the way we actually look after our people here, the elderly, we've isolating them properly now, and they're not, they are not the ones that are going into hospital, certainly not in the percentages that they were before. So that's good news on just looking after people and stopping the death rate from going up too high. The thing is about treatments, though. When we come onto that, then that is something phenomenal what Israel is doing. Do you want me to start going through those now, Barry?
Well, I'm happy that you spoke about the issue about the lungs, because are you able to tell us about the research that's being done at Jerusalem's Hebrew University under Professor Yaakov Nachmias? You know about this?
I have got Hebrew University on my list of things, but when I come through to the actual detail of what actually treatments and vaccines Israel is working on, it's not one of the major ones that I've got down, because if we explain about how different treatments exist, they are broken into three different categories. We call them active vaccines, passive vaccines, and then general treatments. And it's important for people who are watching this to know the difference, because everyone's waiting for an active vaccine to be available. And that's what you can give to somebody before they get infected. And then you can go anywhere. You don't care if you come across an infected person. It's like the flu vaccine. You're better than the flu vaccine, because the flu vaccine didn't protect everybody. But these new vaccines they're trying to work on should protect everybody from getting the COVID-19.
What can you tell us about any research or development going on with regard to the vaccine? Because that's the issue that most people talk about, first of all.
As I said, there is no active vaccine in the world yet that's on the market that's available. In fact, they're starting clinical testing, which means testing on humans in only a few places. There's a company called Moderna in the US. The Oxford University is doing a vaccine which is now being trialed on humans, and possibly there's something in China that they've been working on. But of course, you don't know what's going on really in China. But in terms of Moderna, which is actually using live test subjects at the moment, the chief medical officer of Moderna is an Israeli. Unbelievable, we get everywhere. Israelis get everywhere. They're because of their skills they've got, they are sought after all over the world. And this is one company which has been obviously working with Israel before, and has got Israelis in there. And we have negotiated when they're ready, which is probably at least another 6 months away from having a vaccine ready. We will be first on the distribution list for that vaccine. So that's just one area. We also have been working with Oxford University and other companies that are actually working as well overseas. So that's the situation for the vaccines that are actually almost going to be delivered, the first ones. They're not Israeli, but there Israelis involved in actually the development, Israelis involved in the development to get them out there. Now, internally, there are two major active vaccines that are likely to be out within, again, maybe nine months to 1 year, and that's the timescale we're looking at, really. One is produced by an organisation, a company called MigVax, and that's a private company, probably set up by some of these brilliant ex-Russians and other people who've come out of Technion. But they've had a lot of injection of finance, and they've produced a vaccine which is based on the avian flu vaccine. In fact, it's the bird flu. We have vaccines against that already, and they saw that by taking a vaccine that already exists and just modifying it is much quicker than starting from scratch. So they've got a vaccine which will go to, produce something, I reckon, it's within the year, and that's the best that we probably can do. There is another organisation, it's a government organisation, and it's called the Israel Institute for Biological Research. And because it's government, it's got a lot of support from the Defence Ministry and other departments, and that's been producing many things since. But this active vaccine they've got is also based on a previous vaccine that was already out there. It's based on the Ebola vaccine, and so they've got something also which is actually could be within a year. I should mention that the one produced by MigVax has got some very interesting advantages over anything being produced by Moderna in the US, by the Chinese, or by the UK, because it's an oral vaccine, which means it's very much easier to administer. You don't give injections, you can take it as a pill or something. Plus, it doesn't contain the virus. So people like me who've got a problem with my immune system, I can take it and not worry that it's going to compromise my immune system by doing something untoward there. There are three different parts of the treatment that actually it does. So it's got more chance of actually surviving a mutation by COVID, which is, I think people should be worried about. Is the vaccine going to work 6 months down the line? It might work to start with, but if the virus mutates, will it work again? We'll have to start all over again with a new vaccine, go through trials again. So this one, the one MigVax is producing, is actually got more chance of actually being one that we could get away with using only one injection rather than one pill, rather than having multiple vaccines that some of the others do have. So those are the active vaccines. There are probably 7 more active vaccines that Israel is producing in development. One could be the one you mentioned, the Hebrew University one. I've got it down on my list as one of the organisations producing active vaccines. But those are probably starting from scratch, they're looking at scientific sort of reasons why COVID is so virulent, and they're trying to invent something that will actually go against it. So they're starting from a further back position, and that's the problem. They might take a lot longer to get something going.
Just to complete what you said, Michael, about the element about where Israel is in researching a vaccine, you mentioned MigVac. MigVac was actually spun out of the Migdal Galilee Research Institute in Kiryat Shmoni, which is an arm of the Israel Science and Technology Ministry. And I can tell you, back in April, a Jerusalem-based Outcried, which is a venture investment platform, announced that they had raised $12 million funding in a round to help MigVax carry on with their research. So that one that one right now is still coming out of the stage with regard to experiments or testing on animals and poultry. Hasn't yet come on to the human testing. Clinical trials will probably take, as you said, probably a few months. And the other one that you mentioned, the Israel Institute of Biological Research in Ness Ziona, completed successful COVID-19 vaccine trial on rodents, and the vaccine will be tested on other animals for safety before then coming on to humans. And the the chief innovation officer of this organization, this research, this laboratory, said his treatment is expected to take less time to develop a non-vaccine element of that, less time to develop than a vaccine itself. So if we're not talking about any direct vaccine, in other words, an injection in the arm, what could you tell us about other alternatives for fighting the virus? You said there were three elements.
So the next one is the passive vaccines. And the passive vaccines are ones that where they don't actually change the body to make antibodies. What they do is you inject yourself with, or you have your injection with antibodies. Now those antibodies will fight the virus the same as the antibodies that your body generates. But because the virus is already inside you, you've been infected, they're going to put those antibodies in, and they're going to try their best at killing the virus, but then they may not succeed. One, because the virus is much more got hold of you, and secondly is your body has been weakened by the virus already, so you're not in a great position to actually fight the virus from your holistic point of view. So passive vaccines are very good, and we've got a number of those, and some of those are really quite interesting because a lot of them, the ones that actually they're there already, they are working on people already. In fact, people who have recovered, first of all, people who have recovered from COVID produce antibodies. So we've been going around the country taking the what they call the plasma, the part of the blood that actually contains these antibodies, and they've been using that in cases. They call it compassionate use because it's still it's still difficult to get sort of authorization for massive use of it yet, but certainly in compassionate use where you've got seriously ill, critically ill people, they've been using that, and it has saved lives already. So just by taking the antibodies out of people who have recovered, we're actually saving lives, and that's been going on for a while. There's another company, Kamada, which actually has produced a serum from that, so it's like almost like a concentrated form of this, and they've been using it, and that's already been used as well. I don't know how many people it's saved on that, but it's certainly early days. But they've got that out already. And then there's a very interesting company called I'm not sure if we call it a treatment. I'll come on to that later. But those are the main passive vaccines that are around at the moment. I think what's going to happen, the medical companies are actually going around now taking people who have recovered, and they're taking the plasma from them. So that should be available and being going out to a lot of people soon. Yeah, Bar-Ilan University, they've got a patent for research on a passive vaccine. So those are further down the line, and again under development, which will take more time. But the interesting ones are the two I mentioned, which are actually already out there and already saving lives.
So what you mentioned earlier on in your talk was where you were talking about, in fact, various Israeli research and development going on, not so much on the vaccine, but actually getting into an earlier stage in preventing people from becoming seriously infected or needing ventilators. I made mention of the Jerusalem Hebrew University headed by Professor Nachmias. What they've discovered, because they've been researching for months, and they've been looking at how the way that the virus attacks, as you mentioned earlier on, Michael, how the virus attacks people's lungs in order to replicate itself. And they have made a major finding is that the virus blocks the routine burning of carbohydrates, resulting, they say, in large amounts of fat accumulating in the lung cells that allows the virus to reproduce. And they found in lab studies that the cholesterol-lowering drug phenylfibrate from the United States showed extremely promising results. So what they're doing is by using this together with their own formula, by allowing lung cells to burn more fat, the phenylfibrate broke the virus grip, if you like, on these cells, and within, they say, 5 days of treatment, the virus has almost completely disappeared. And this is what you were saying before, Michael, that if you could stop patients going from having the infection to be seriously infected and then going on to ventilators, you stop it in an early stage. This at least prevents people from getting seriously sick and dying before the world or somebody, maybe Israel, can find an infection. So actually, Professor Nachmias, I have a quotation here for you, Michael. He said, in our findings are borne out by clinical studies, this course of treatment could potentially downgrade COVID-19 severity into nothing worse than a common cold. So, I mean, I agree with you. While everybody's trying to find the magic elixir, i.e. the vaccine, there are things that can be done that can be done once they pass the various stages in order to help people or prevent people getting seriously ill. What more can you give us on this aspect from the research or the things that you found?
The interesting thing is that this is such an unknown virus that we're finding things about it all the time. And in fact, as you say, they found that a particular treatment already around can kill the virus. They've got other treatments as well that can actually kill the virus. They've got a treatment they said that actually was used on Gaucher's disease, and that's actually they've tried that out as well, and that has made a major effect on people who are critically ill. I think Red Hill Pharmaceuticals, they've got a trial of a drug that they've got as well, and it's been used already on other diseases. So it's like we're finding that you can use a particular treatment. It's already got FDA approval, it's got European approval, and all we just need to do is to get some testing done to show them that it does impact on the COVID patients as well, and then they will be out there and ready to do this to help with treating these cases as well. And then there's other things as well. I mean, do you know nitric oxide is actually used and can kill the virus? So this is sort of like we've got something that's already been around for a long time. It's been used in many other treatments of diseases, and it can actually kill the virus. So a lot of this, and it's because we're learning, because these universities have researched in detail the whole aspect of medical science around COVID already, and they know a lot about it, but they find these things and they say, right, maybe this will work, maybe that will work. I know from personal experience that for autoimmune diseases, they find that one disease that you use for, say, multiple sclerosis can actually work in a colitis patient as well. So because you are sort of you're getting this sort of cross-pollination, I call it, of medical treatments. There's so much out there that can be used. The other ones I'd like to talk about are some really new stuff that Israel have been working on before, and a company called Pluristem. They have what we call stem cells. They're called PLX stem cells from the placenta. It's not from anything else. It's just waste products from giving birth. But they've been using that for a long time in treating various different diseases. They've used that now in many cases in Israel, and it has had phenomenal improvements on those patients. So that does a sort of, it's very strange. I mean, it shows that they are sort of building. It's strange. It's how it works. It's sort of working on the respiratory system again, like you said, the lungs and all that side of things. It's building. It's stopping this. You heard about this. It's a storm that happens with the immune system, which goes out of control. I think it's called cyclotic storm or something like that. Yeah, it causes an overload of the body, and it can't cope with it. So that particular treatment stops that storm from happening. And other treatments, would you believe, medical cannabis is being used in that respect as well. If you think about it, I suppose the relaxation of those muscles in the lungs would actually help you breathe better. And that is also stopping this storm of immune cells hitting the lungs. So those treatments are pretty incredible. When you talked about again previous treatments that can be used on other things, there's a psoriasis treatment, and it's used on psoriasis and rheumatoid arthritis. Now they're starting trials on COVID as well. So again, all these drugs that we've got out there that are working and have got approval in a lot of areas can be used to treat the virus.
Yeah, the other two things I wanted to note is you mentioned before about the Israel Institute of Biological Research. They said very recently that it had completed what they call a groundbreaking scientific development towards a potential treatment of COVID-19, and it's based on an antibody that neutralizes the coronavirus that causes the disease. So, you know, the Israel Institute of Biological Research are really pushing the envelope in a number of avenues connected to the virus.
Yeah, I think at one point they had 8 antibodies that they had isolated that would actually attack the virus. So if you think about that, you know, they have so many different possible solutions, and you know, it's looking hopeful that certainly these could be used in the not too distant future.
The COVID-19 basically is posing extraordinary challenges for people involved in R&D. And one problem is to drastically reduce the transmission probabilities in indoor spaces. You know, when these people who are supposed to be the health experts were saying the COVID is spread by people outdoors meeting on beaches and parks and things like that. Now they've changed the statistics and the projections and said, well, basically most of the people are infected by being indoors. And the other thing that's happening around the world, particularly in some European countries, certainly in America, you have local governments who want to keep everything closed down, including workplaces, offices, and things like that. But there is something, you could probably tell us something about it. Some of the notes that I have on it is that simply by improving ventilation isn't always possible or even adequate. And although covering the nose and mouth can decrease the risk with a mask, it's not the ultimate answer. However, can you tell us anything about Protect Air? Do you know that company?
Yeah, I think I've reported that on my website. Yes, I think that's the one that has.
It's developed a device that sterilizes indoor air by slowly releasing chlorine dioxide, CO2. Which is powerful against viruses and other types of germs, because only a very small amount deactivates the virus as soon as it gets onto the outer spikes, and you don't need to get into the core of the virus to kill it. This, according to the founder, Tzvi Dahan, and I'll quote him again: the efficiency is therefore very high, and it's safe because it doesn't go into the body; it stops at the spike. What was interesting in this is that the system was invented by Tzvi Dahan's brother, Meir Device, and who was Meir Dahan? He was a specialist in machine and water purification for 15 years at the Sorek Nuclear Research Center here in Israel. Now, what's useful about this device is it's a small device that could be mounted on a wall or placed on a surface, and it doesn't need electricity, Wi-Fi, or batteries. For a very big space, you might need about 4 or 5 units. And it comes in a sachet with granules to place inside, and refills are needed about every 4 weeks. An optional upgrade is like a gel that's a little more powerful. So what happens, they open the package, activates the gel or the granules, and by nature, the chlorine dioxide vaporizes and oxidizes very quickly. But the Protect Air formulation allows it to be released gradually and uniformly. So it's been tested efficiency against the virus at the Israel Amni labs, and has undergone safe testing in Israel and overseas. Now, according to what Tzvi Dahan says, You can buy this in a store, basically. 2 hours after you put it in the room, the air is sterilized and continues to be sterilized for 3 or 4 weeks. You don't need to do anything to activate it if a person sneezes or coughs. So sales are beginning here in Israel. And Swedenborg says we're speaking with government ministers to get protected air units in public transportation, schools, and government offices. And we're talking to the Israeli company about marketing globally. Well, you can imagine if this small thing that you can put on a table or on a wall can actually stop the virus spreading within offices or schools or supermarkets. Can you imagine the real relief that would be made on the world?
These are excellent ideas and innovations coming from Israelis. There's another one I think called, which is from ultraviolet light. I think it's UVC, and they prove that can desanitize a hospital ward. They had problems before with ultraviolet light in that, yes, they knew that it could kill viruses, but it caused ozone to be created. So the Israelis have managed to develop something which doesn't produce ozone, which means it's safe to use even with patients in the room. And that's a great leap forward. I just wanted to show you, you talked about masks and not being effective, but this is an Israeli mask made by Synovia. And inside, it's not just a mask, it's not just fabric, it's impregnated fabric with zinc ions. And the zinc, when a virus hits it, the ions in the zinc will attack the virus and actually kills the virus. So it's actually protecting the person who's wearing the mask as well as the person who you're speaking to or come near to. And this, as far as I know, was the only one that has been out so far. They are bringing out very huge, credible masks that can actually stop the penetration of the virus. But in terms of actually killing the virus before it gets to your lungs, this is one of the first ones that I've seen that does it. And it's available on the internet now. You can buy it. I bought several. People have been buying them for England, for their communities in England, and it's certainly something I would recommend.
But Sanofi is an American company. Is that made in Israel or is this abroad?
No, it's Israeli. It's Israeli, Barry.
It's Israeli. Ah, okay.
Go on to www.synoviatech.com. And
okay,
yeah.
That's useful because again, this I would have thought this would be very, very useful for the health workers in hospitals and everything, rather than the regular masks that they were, apart from the PPE.
They use ones, but this is good for home use.
Yeah, but also when I mentioned about the lighting and the protector inside working spaces, it amazes me that governments don't get behind this with a lot more financial support than throwing it at the vaccine. The vaccine is very important, but I would have thought that if you have this sort of thing that can make it very safe for people to work inside spaces, whether as schools or restaurants or workplaces, offices or whatever, factories, that in fact you would think they would put up the money for something like that, because these things are ready to come to market almost immediately. Protect Air is already coming on the market right now. And if that reduces people getting infected from being indoors, I would have thought that would be very useful to begin with, because it would lower the statistics.
Yeah, on the subject you're talking about finance, Barry, I have to say that the Israeli government is actually financing a lot of these innovations that Israel is producing, Israeli companies are producing. In fact, the Israeli Innovation Authority, which is a government department, part of the chief scientist as it used to be, it actually is actually financing at the moment 9 million shekels for 25 different COVID-19 projects. So that's where the government is going. I mean, it's obviously spending huge amounts of money on trying to protect the citizens of Israel, but it is putting money into these separate things. And like I said before, the vaccine that it's producing the active vaccines that it's producing is also government funded as well. So, but in terms of this, the financing comes in also from private. Into private companies as well. The finance industry is very keen on Israeli innovations, and it's putting loads of money into this because it can see that these companies can do really well from an investment point of view by putting money in there. So venture capitalists are putting loads of money into these companies. I just want to move on now. I mean, it's where Israel is in the world now. It's doing huge amounts of things, like you said before, where people don't actually realise how much Israel is involved in their day-to-day lives. From a point of view of, I was originally in England. My job was in cyber security, and Israel is the leading country, certainly by capita, in terms of cybersecurity. So protecting computers, and these days of COVID-19, where everybody's indoors using virtual online systems, Zoom, etc., this is what's actually protecting them. There have been some pretty big attempts to hack into companies. I think you find that EasyJet and a few other companies have had break-ins to their systems. They probably weren't using Israeli cybersecurity to protect them, and they probably are now. But that sort of area is very, very important, and you can see that with things that's going on with Iran as well, that's protecting us as well. Going on to other areas where Israel is really making a big impact in the world. Its humanitarian aid to countries is phenomenal, and whenever there's a disaster, Israel is out there. Either the IDF, the Israel Defense Forces, are in there setting up field surgery centres, or it's sort of the Israel Aid. Israel Aid every time there's something, there's Israel Aid is there. So whichever country has had a disaster, an earthquake here, where it's in Haiti or whether it's anywhere in the world, they go in there immediately. But one organisation which really we should really sort of commend very much is Innovation Africa, because that is like putting in solar power and drinkable water into countries across Africa, saving millions of lives, and that's so really heartwarming to see that thing. Then let's go into sort of the areas that I like to do. It's some of the areas that are being developed at the moment in autonomous cars. So companies like Mobileye and Waze may have been taken over by huge conglomerates, American conglomerates, but they are still based in this country, and they employ 90% of their staff are Israelis, and it's still the innovation is still coming out there. All the R&D, even when the company is taken over, the R&D stays here in Israel. So in those areas where we're developing things for the vehicles, that is very, very important. And I just want to finish on an interesting story. It's got it here in terms of it's an Israeli startup. It's part of it was a part of an incubator in the Negev called Startup Negev. But the company it's just known by its initials, SMBIT. It developed a solar-powered collar which goes around the neck of a camel, and what it does is it issues a GPS signal. That signal will then, if that camel goes with anywhere near about 100 yards or 100 meters of a road, then it sends an alert through Waze to alert drivers in that area that there is an obstruction in the road. Because believe it or not, dozens of people have been killed by having collisions with camels in Israel, and that's one area where innovation and local knowledge has sort of been combined to actually save lives.
Oh, well, people should know as well, even you don't need a camel, but if you're driving your car and it's finding the easiest way to get from point A to point B, wherever you are, you should know that Waze directional aid is in fact made in Israel. I'd like to give a plug, Michael, also to an NGO, an organization that I've been involved in. It's Save a Child's Heart. And this started by a team of Israeli doctors in the Tel Aviv hospital treating very young children, babies even with heart defects, everything. And what Israel has been doing covertly a lot of the time is bringing in seriously sick children from a lot of countries, Africa, Asia, Middle East, including lots of countries that doesn't have any diplomatic connections with, who are considered enemies of Israel. But the children are brought to Israel, to this Tel Aviv hospital, and given a new life. And now these Israeli doctors are, in fact, taking their expertise into Africa and other places and setting up hospitals strictly for treating younger children with heart defects. So with that, Michael, before we wrap up with you, I want to give an opportunity to our people who have heard you, who want to make contact with you and to receive your regular bulletins. How do they make contact with you?
Thanks, Barry. Yes, the best way to get in touch with me is through my website. It's got all the links for subscribing. The website is www.verygoodnewsisrael.blogspot.com. It should be up on the screen below, so you can take it down. But that's the best way of doing it. You'll get a link there to the website where you can sign up. You can also, it'll give you my email address where you can email me directly, and I can put you on my list, and then you'll be receiving great news every week. I do recommend it. It's really inspiring. You can also, as I said, if you're researching into anything for any reason, if you're giving lectures or something, or talks about Israel, look at my database of where I store all the information. That's also, the link is on the website, and it's called Israel Active. And that contains 17,000 different articles, which you'll find information about what Israel is doing positively on so many different subjects, probably more than you can even imagine. And good luck. Thank you.
Thank you, Michael. Thank you very much for being on the show. I think it's been very elucidating for a lot of our people, and I hope more and more people will be making contact with you and learning what we're doing here in Israel to help give them better lives. Thank you, Michael. Before we close, by the way, I promised you a couple of very important announcements. Here's one of them. Israeli travelers, people traveling out of Israel. This is going to happen in a few weeks' time. 72 hours before your flight, passengers will be screened for coronaviruses at one of the drive-through testing stations in Israel, and you will receive the results on your mobile phone. And if the traveler's test results through negative for the virus, the passengers will be able to go to the airport, where they will receive a second test, which will be performed. And the results of that test will be received by travelers going out of Israel upon arrival at their destination, so that they can present 2 negative tests to the immigration. Now, foreigners, for instance, people looking to enter Israel, the spokesperson from the Israeli ministry have said that they should arrive at the airport and be immediately screened. They would enter isolation in Israel for 24 hours while waiting the results. If the tests are negative, they'll be able to continue with their vacation. And if the test is positive, the visitor will have to remain in quarantine, in isolation for between 10 and 14 days. Now, the final decision of this move about opening up Ben Gurion for flights will be made in cooperation between the Health Ministry, the National Security Council, and the Prime Minister's office. So that's worth looking out for. On a personal note, I hope that some of the information we've given you today, with a lot of the innovations we're doing, not just to do with COVID and other things as well, would be interesting you people who actively support Israel. And it's a way of actually defining the BDS movement. That's the Boycotts, Divestments and Sanctions movement. And I'll give you one other tool which can seriously help you help fight the fight against BDS. And that's arm yourself with a copy of my book, BDS for Idiots. You can get this book on Amazon in paperback or on Kindle version, or you can buy it from any Steinmatsky bookstore. You can buy there on the shelves or order it from there. You'll find it very useful because basically the good news that we're telling you here, I hope you will use to offset the bad news and the lies that people like the BDS movements and others are putting out against Israel. So again, I hope you found this show very, very interesting. And I invite you to the next version of The View from Israel. Thanks for joining us. Spread this link around and let other people know what Israel is doing good for the world. Thank you and goodbye from The View from Israel.
Life has ground to a halt as the world battles the deadly spread of COVID-19. In Israel, Wolfson Medical Center in Holon is on the front line of this struggle. Wolfson serves an aging patient population, including numerous Holocaust survivors and war veterans, many with pre-existing medical conditions, the people most at risk if they contract the virus. The medical center has already established a small coronavirus care unit, but the flood of new cases threatens to exceed its ability to provide life-saving care.
We need more ICU beds, we need more ventilators, syringe pumps, we need all kinds of medical equipment.
If we had more facilities like this and more equipment like this, we could have treated the patients in the corona unit better this way.
Save a Child's Heart is helping take on the challenge. For more than 2 decades, this international nonprofit humanitarian initiative has provided life-saving cardiac care for children from developing nations. But restrictions on international air travel have forced it to suspend its normal activities.
We are now at the middle of a very difficult time, frustrating, I may say even sad, times that we cannot reach to our young patients abroad. We cannot fix their broken hearts, and that breaks our hearts as well.
But Save a Child's Heart remains committed to saving lives. It's rushing to complete work on a new dedicated children's hospital. By moving young patients here from the Wolfson Pediatric Ward, we can enable the medical center to free up the beds and facilities needed for a new 60-patient coronavirus critical care unit. Save a Child's Heart is proud to be part of this effort. While we continue looking after our youngest patients, we now have a unique opportunity to help their parents, grandparents, and great-grandparents. Together, we can shape a better future for our children and for all of us.
This is Claudine. She's 13 years old and she's recovering from heart surgery at the Wolfson Medical Center in Israel. Claudine landed here from Rwanda a week ago as part of the non-governmental organization Save a Child's Heart program.
It started from a dream of physicians here in this hospital to give their knowledge, their skills, medical skills to the world. We already operated 5,000 children all over the world, 5,000 children that their life were saved.
Claudine is here as part of a group of 8 kids. The children, sometimes as young as newborns, come in organized groups for treatment they can't get in their home countries.
Now we have been treating more than almost 60 countries. Half of them are coming from neighbor countries around us, which is the West Bank, Gaza Strip, and other countries around us. And other kids are coming from far away, some of them from Africa. But for instance, Claudine here has something that is rheumatic heart disease, which is endemic in Africa. And there are so many kids that are suffering from rheumatic heart disease just because they didn't take antibiotics. and their heart is damaged because of that. And we bring many of them here to Israel to fix their valves.
Many of the children come without their parents. Instead, they have nurses, like Janine, who hold their hands and help them get through the difficult time.
We give something to eat, change pampers, changing the cotton, everything who her mother can do for her children. It's me, I do that because I'm the place for her mommy.
The work done to help the kids is apolitical and remains untouched by politics and relations between countries. 10 minutes away from the hospital is the children's home.
These children are from Iraq and from Tanzania and Rwanda and Ethiopia and the Palestinian Authority and Uzbekistan, which is the 16th country we brought a child from. The children brought to Israel from faraway countries stay here between 2 to 3 months. And in addition to treating the children and training the doctors, we also send medical teams to partner sites that we have in the developing world to work together with our partners to screen, to diagnose, and to treat children on site.
In recent years, thousands of sick children, some holding on to their lives, have stayed right here at the Save a Child's Heart Children's Home. They've waited for surgery, they've recovered from surgery. And today, thousands of children still play because they have a heart that now beats right.
And in this house, there are so many children from really so many different countries and ages and languages. None of them speak the same language, but they're friends, and that's how children are. Children are children, and they fight, and they smile, and they laugh, and they play together again.
The phenomena of bringing children from Iraq, from the Kurdish side of Iraq, that has suffered very, very much the last recent 10 years because of the war there. This is something that we are very proud of. Bringing children from Africa, bringing children from all places that children need to be taken care of.
Every child has his own story. You know, I can't imagine life without Satya anymore. It gets into your life, and then it is your life.
I have good cooperation with Save a Child of the Heart since 20 years ago in referring patients from Gaza every Tuesday to here to Wolfson Medical Center. When I came here, I'm feeling not strange here. I'm feeling part of this hospital.
يعني الولد هذا اجى معاه مشاكل كثيره في القلب، تعرفنا على الجمعيه هذه فحولونا هنا. الست فاطمه هنا هي ممثله للجمعيه، ضحكوا علينا بودوا لنا فاكس بنسوي تسريح ونيجوا هنا.
اول شيء بنشكر الجمعيه اللي اتاحت لنا الفرصه نيجي على اساس المستشفى هنا، مستشفى خدمه الاطفال. كان عمرها طفل هذه شهرين، فكانت تعاني من عندها ثقب في القلب وفي الصمام مشاكل قدمنا الأوراق وحولونا على المستشفى هنا يعني، والحمد لله الشكر والفضل لهم. نتشكرهم كثير للجمعية وللمستشفى وللدكاترة.
Hi, I'm actress and neuroscientist Mayim Bialik. For more than 1 million children born each year with congenital heart defects, life is tenuous. Why? Because life-saving heart surgeries are just not available. But now, Save a Child's Heart is providing these surgeries free for children who have no other chance. Thanks to these volunteer doctors and nurses, over 4,000 children in more than 50 countries live and thrive today. Save a Child's Heart. Find out how you can help.